Good morning, everyone, and welcome to part 2 of a 3-part webinar series on workforce development that's hosted by the Minnesota Transformation Initiative, or MTI. MTI is a project that's funded by the Minnesota Department of Human Services to support the transition of people with disabilities receiving subminimum wages into competitive integrated employment. An essential piece of providing high quality and effective supports to people with disabilities to find and keep employment and to live and be connected within their communities is having a stable and well-trained workforce. Unfortunately, given the workforce crisis that we are experiencing right now, many provider organizations are focused entirely on just having enough staff to get by. We're grateful to have Megan Sanders and Claire Benway joining us today to share training strategies provider agencies can consider to develop skills and improve retention of the staff they have. Megan Sanders is a national workforce consultant at the University of Minnesota's Institute on Community Integration. She provides training, consultation, and technical assistance to provider organizations, states, and individuals to address workforce challenges for direct support professionals and frontline supervisors. Before joining the ICI staff in 2020, Sanders worked as a direct support professional and a frontline supervisor. She earned a master's degree in social work and a master's degree in public policy from the University of Minnesota and a bachelor's degree from Truman State University. Claire Benway provides technical assistance, training, and development support within the direct support profession. She works on state and federal projects focusing on improving community services for children and adults with intellectual and developmental disabilities. Her current projects involve training, technical assistance, and state policy development in person-centered thinking and planning, direct support workforce development, and community living. She is the state administrator for Direct Course Minnesota, an online curricula in direct course, and holds a master's from Emerson College in Boston, Massachusetts. So I'm going to turn it over to Megan and Claire. Thank you so much for joining us today.
Thank you, Danielle. It's good to be here, and it's good to be here with you all. For those who were at the first webinar, welcome back. We're glad you're here. For those who this is your first webinar, welcome. I believe that there is a recording of the first webinar if you would like to see it. I think, Danielle, would you be able to put that link in the chat? Thank you. So our first webinar was about how to use your data, how to collect and use your data to make database decisions around your workforce. And then this webinar will be about training staff, which is a huge topic, and we can only cover so much in an hour. Trust me, I tried to cover a ton, and I realized that is a whole day's worth of training. So we're going to cover as much as we can in an hour. And if you have any questions, we'll try to save time at the end for questions as well. So for those of you who don't spend a lot of time on Zoom like myself and my colleagues do, here's a quick how-to. There is a toolbar typically at the top or the bottom of your screen that has these items on it. If you're having trouble hearing me or seeing the screen or whatever, those audio settings can be helpful to you. The closed captioning should be on. You should be able to turn that on your own computer, and that is by clicking the show caption on the same toolbar. If you have any questions throughout the session, we prefer that you use the Q&A panel to ask those questions. It's easier for us to manage those questions if they're in the Q&A panel rather than the chat. But throughout the session, I'll be asking questions of you. So if you are able to use that chat side panel to answer the questions, that would be really great. We want to make this as interactive as possible so you don't fall asleep during this hour. So please feel free to make comments and talk amongst yourselves in the chat as well. Like I said, we'll save time at the end for questions. You can use the raise hand feature when that time comes to ask any questions as well if you're not able to find that Q&A feature. And if you have any questions about Zoom, post in the chat or whatever, and I'm sure my colleagues can help you navigate Zoom. So just a little bit of a precursor to all of this. I, Claire, and Danielle all work at the Institute on Community Integration, or ICI, and our focus is to improve policies and practices to make sure that all people with disabilities are valued by and able to contribute to their communities of choice. like Danielle said, you can't do this without a well-trained workforce. So we are having these series to help support you, begin to support you in developing your workforce. And know that at ICI, we have over 30 years of experience of technical assistance and research and training around workforce. We use that research, we use that training and technical experience and general experience that we have on a large team at ICI to really build best practices and guidance to develop the workforce. Our goals for today are to talk about connections between data and training and talk about best practices for training staff to competence. We also are using today in the hopes that you are able to reflect on the current training practices that you use and begin to plan for change and improvement of those resources. Before I go on, I just want to make sure we all know who I'm talking about. When I'm talking about the direct support workforce or DSPs or direct support professionals, I'm talking about people who support people with disabilities. We don't have a national name that we call them. It's a very organizational specific. When I was a DSP, the DSPs at my organization were called living skills instructors, and it took me 3 years to understand that I was a DSP, even though that was not my title. Some other roles or names that DSPs can go by are personal care attendants, direct care workers, direct support staff, community living specialist, job coach, or employment specialist. There are probably other names that you all call your direct support professionals. If you want to put in the chat what you call your direct support professionals, or if you're a direct support professional, what you are called, that would be great. We love to learn new terms and new phrases that we can add to our list here. And as we continue, I'd like to run a poll to see who is here. So we make sure that we are giving you the right information that you need. So Danielle, can you launch that poll? This is a poll where you can select all that apply. So if you provide direct support and are also a family member of a person who receives supports, you can select both of those things. So select all of the roles that you live in this field. Someone put in the Q&A that they call their DSPs delight specialists, which is lovely. That is definitely a new term that I have not heard before. I'm also seeing that some people can't use the chat. So you should be able to now. I just turned on that feature. Sorry about that, everybody. Career coaches is another one that someone said. And yes, if you select other, please tell me what role you are. Okay, we can go ahead and close that poll and share those results. So it looks like we have a lot of supervisors and leaders and a few from other roles as well. Regardless of your role, we're glad that you're here. And a special shout out to those who provide direct support. I'm glad you're here as well. So thank you all for being here. We can stop sharing those results. And move on to, before we talk about how to actually train staff, I want to talk about the importance of training the direct support workforce. So we all work in the field. We all know that the direct support professional position is really complex, even though it's often listed as an entry-level job, because we're willing to train direct support professionals to competence. It's a really hard job, and it takes a lot of skill and a lot of knowledge and a lot of skill to be able to do the job. So In any given day, a direct support professional might be playing the role of a teacher in teaching someone new skills. They might be playing the role of a nurse in giving a med. They might be playing the role of a counselor in supporting someone with a problem that they're having, or a physical therapist in supporting someone to strengthen their knees because they have knee pain. There are a ton of different roles that a DSP plays in any minute of any day. And as you're looking at this chart and looking at the different roles, can anyone indicate in the chat what similarities you see in all of these roles that are listed, in all of these professions that are listed? And it's not a trick question. Caregiver, yep, all these people have a kind of caregiver role. Yeah, they work directly with people, they're helping professions, they serve the individual as an individual, so very person-centered in how they should be delivering their position. They require training, yes. So all of these require a ton of training to do their job, right? I think, well, most of them require an upper level degree. All of them require some kind of certification or some kind of additional training that they need to be able to do the job. And a lot of these are delivered by some kind of national standard board, right? Or at least state specific standard board. DSPs don't have that, right? The training that a DSP gets is very organizational specific. If I start at one organization, I'm going to get a very different training than when I go to a different organization, which is okay because people are going to be different at those organizations. But that also does create challenges for direct support professionals. We also know that in the busy world of direct support, typically about 40 hours of training is provided for DSPs. But we also know from our research at ICI that about 240 hours are needed to just complete the basic amount of training that a DSP needs to do their job. And so the best thing to do is to balance that scale and train to competence, which we'll talk about a little bit later today. We know from our research that DSPs who don't have good training, it tends to mean that the quality of supports are lower and satisfaction in services are lower as well. We know that this results in higher turnover of employees, both in those employees who aren't receiving the proper training, right? Because if I'm working a job and I don't feel confident in what I'm doing and I don't feel like I know what I'm doing, I'm probably not going to stick around long. But also in those staff who have been around a really long time, right? They grow frustrated, they get burnt out, and they're gonna leave if they don't feel like they're getting support from their coworkers and they're able to work as a team. We also know that people who don't get the right kind of training need more supervision, right? They're making more mistakes, they're needing more support, which means that supervisors need to be more present and more active and provide a lot more support than they have time for, which also can result in supervisor burnout and turnover. We know that with all of this turnover that I'm talking about, that means that you're going to be doing more recruitment and more hiring to replace those positions. It means that there's going to be more need to continue to retrain and to continue to train on the same things that you've already trained on. Altogether, we know that results in higher costs, right? We know that the mistakes that are made because the person's not getting the right kind of training or the right kind of support. We know that the turnover and the cost of replacing those staff are really high. We know that all around those costs are really high costs, not to mention like that's just a monetary cost, but then also thinking about all the other costs that come with staff who aren't well trained. We also know that this is a national problem. So it's not just at your organization or it's not just in Minnesota. We know that throughout the country, there's an issue of limited training and development, along with low wages, unaffordable benefits, and lack of career advancement opportunities. So we know that this is a national problem. We know that this is something that needs to be addressed and has been a problem for a long time now. And we know that, again, that results in challenges in recruiting and retaining high quality employees. And low quality services and poor outcomes for the people receiving supports, which is why we're doing this work, right? We want people receiving supports to have good lives and good services and good outcomes. So really important that we address that training and make sure that people are getting the training that they need to do their jobs and to support people in the way that people want to be supported. I have a few poll questions coming up just to allow you to reflect on how you train at your organization. So I want to know first how you decide what topics to train on. So there are a lot of different training topics. Like I said, over 240 hours of training topics to just have somebody be able to do the minimum part of their job. But how do you decide what things you consider when you're thinking about what to train on? So I'll give you some time to read all the answers. Again, this is a select all, and I'll give you some time. And if you click other, please indicate it in the chat so we know how else you decide. There's a lot of options here, so I think I'm going to give it another like 30, 45 seconds. Okay, Danielle, can you end the poll and share? Okay, so a lot of you say you train based on regulations. That's great. That's obviously required in the state, so it's great to hear. You assess each person for their training needs. That's amazing. That's a lot of work, but it's definitely worth it in the end. So I'm glad that a lot of people, about almost half of you, do that. Using a list of competencies. I think the poll question cut off all of the list of competencies that I included, but some examples are those NADSP, National Alliance for Direct Support Professionals competencies, the CMS Direct Support Worker competencies. Someone put in the chat the ACRE and CESP competencies if your direct support professionals are working in employment. There's quite a few competencies out there. There's the National Frontline Supervisor competencies for supervisors. But there's a lot that you can use that have been developed through research and using subject matter experts over the years that are a really good start to make sure that you're covering all the things that a DSP might need to do their job. About 7% of you say you use the same training for everyone, and 21% of you say you ask staff what kind of training you want, which is a really great practice. Some others that you say in the chat are training topics also based on organizational and persons receiving services needs. That's great. So another good practice is training people based on your mission, vision, and values, right? That's a really important one as well. Training to the services that they provide, because those services are very different, very, very great. Paperwork is different, so you're going to be training them differently. Through auditing, that helps identify recurring issues or gaps in knowledge. Yep, that's a great practice as well. Some people are saying no poll showed up. That might be some kind of weird glitch. So I'm sorry if you weren't able to take part in that poll. Claire, am I missing anything when we're talking about best practices when you're thinking about training topics?
No, I think you're doing a great job. I think there's always nuances within them. So I guess maybe ask the group, are we missing anything that they want more clarity on?
Yeah, any questions about any of these? These are all really great practices when you're thinking about what kind of topics you need to train on and what kind of what to consider?
I think one of the only things that is not covered in this poll, which is a good thing because we don't want this kind of training, is that JIT training, just in time training, which is a pitfall that we can typically fall into when we are not thinking about this topic, right? And what that typically does is puts us in that reactive state of training, which is not as effective as it could be. So.
Thank you, Claire. Yes, that's a great point. Okay. So our next question is about how you train staff. So you've chosen the training topics, you know what you want to train staff on. What kind of curriculum do you use to train staff? Do you train people in person, online, through some kind of computer-based training platform? Again, those options got cut off, but that would be like Open Futures, Relias, Direct Course, training programs like that, or maybe a combination of the above. And just so you know, this one is what you have to select one. So if you do a combination of the above, click combination of the above. We'll give about 10 more seconds. All right, Danielle, could you end that poll and share those? So a lot of you do a combination. That's a best practice. That's for sure a good way to do it. Having those computer-based training platforms are really wonderful because you can, people can choose what they need, right? People can explore the curriculum and decide what they need to take. And B, they can do it on their own time. And in the busy world of direct support, we need to be able to allow people that flexibility to do it on their own time and to come to the trainer or the supervisor or whoever with any questions that they have. In addition, we know that in-person training is also really essential, right? There are some things that you just can't teach online. And most of the things that you teach online are important to be reiterated in person or in on-the-job training so that they understand how that can be applied to the job. Claire, any other things I'm missing here?
Nope, I think you're covering it. Again, when we think of that combination, really understanding that that is not like I do one training here with this topic and one training online with this topic, that it's really connecting both of them together, that asynchronous learning. And I know we're going to talk a little bit about that in a minute.
Yeah. Great. Thanks, Claire. And we know that it doesn't look like the people in this room do, but we know that live online is something that a lot of people are focusing on to prevent those unnecessary COVID exposures. But it looks like that's not something people are doing here, which is fine. If you found how to make it work in person and with a mix of computer or whatever, that's great. And then finally, do you or your organization train staff using competency-based training? And if you don't know what that is, that's fine. Click the option, what's competency-based training? Give it about 10 seconds. Okay, Danielle, can you close that poll and share those results? Thank you. So 73% of you use competency-based training to train staff. That's great. I've seen in the chat, some of you are using those CESP competencies. Some of you are using the ACRE competencies. What other competencies do you use? Can you put those in the chat? Because like I said, there's a lot of competencies and some organizations elect to not use any of those and make their own set of competencies that they use. And for those 17%, and 9% who don't or who don't know what competency-based training is, you're in the right place, because we're going to talk about that in just a minute. College of Direct Support. So that is direct course, and we'll talk about that a little bit later. College of Direct Support uses competencies to build the content, but it is not a set of competencies, if that makes sense. Did I explain that correctly, Claire?
Yep.
Clearly?
Yeah, no, that's great. So just a quick distinction is that competencies would be, for example, things that like there were the original home and community-based competencies, right? And those then turned into our NADSP competencies, right? So those national organizations that are saying this is that set of known and understood skills that are required to do this job. Now that is in the absence, remember, of a certification that says you are a certified DSP. So other professions with certification also have competencies. There's also the NADD competencies, and then my personal favorite, the frontline supervisor competencies. Again, looking at what are those knowledge, skills, and abilities that someone has to do. College of Direct Support, or as some people know it as direct course, and let me umbrella that one out for us, is the College of Direct Support is a platform, right? And within it are multiple different curricula. So we've got CDS, or College of Direct Supports, and then we've got I'm sorry, I said that backwards, didn't I? Direct course, and the College of Direct Supports is underneath it. There we go. Thanks, Megan. And then College of Frontline Supervision and Management, College of Employment Services, and then Person-Centered Counseling. Those are all ones that actually you have access to in Minnesota. There are some others, but we didn't focus on them today. And so within the College of Direct Support and Direct Course, the university, who is the content developer for that, is utilizing those competencies that we that have been nationally vetted, basically looked at throughout the profession as what needs to happen. So just making sure that there's that distinction, is that the training platform or the training materials that you use may or may not have been developed utilizing a specific set of competencies.
Thank you, Claire. And just to go back, so you know what competencies are, because I'm seeing a question about where to find more information about it. First of all, competencies as a whole, like Claire said, are in many different professions. Many different professions have different sets of competencies, and DSPs have many different sets of competencies to choose from. But competencies are really about focusing on outcomes. So what outcomes does someone in a profession need to be able to do their job? So when you're thinking about competency-based training, focusing on building that knowledge. So what do I need to know to do my job? What are the different things I need to know? And then building those skills and abilities. So what do I need to know how to do? And then those intellectual behaviors or dispositions or like attitudes that a person might need to be in the role, right? So one attitude that a DSP might need is a very simple one, that people with disabilities deserve to live and work in their communities of choice, right? That is a pretty simple one that can be developed using competency-based training. And then finally applying those to the job. So we just don't want people to just learn the things. We want them to actually apply them to the job and use them in the job, so that they are better DSPs, and they're providing high quality services that align with what we know are best services to provide support. And yes, for employment providers, I'm seeing in the chat, the College of Employment Supports provides robust employment content based on CESP and other competencies. Yeah, so that is a great comment as well. We did say quite a few different competencies we've used in passing. Maybe I'll ask Claire, would you be able to throw at least the names of the competencies into the chat? So that they're all in one place for folks.
Yep, I'm actually already compiling that list. So just give me a minute, and I'll get links in there for people as well.
Thank you very much, Claire. I appreciate that.
Yep.
I'm asking her to do some things on the fly, so thank you. But there are a lot of sets of competencies that you as a direct support professional or you as a leader in your organization need to go through and decide which applies most to your organization. Like I said earlier, some organizations or even states elect to create their own set of competencies, but these are really good base competencies that you can use to understand what kind of training someone needs in order to do their job. My slides are acting up. Okay. Before we move forward into talking more about competency-based training, going back to that first webinar, I talked a little bit about how you can connect your data to determining what workforce strategies to implement and what might be helpful in your organization. If in your organization, you've done all your data collection, you've talked to your staff, you've talked to the people who are supported in their families, and you found out that maybe performance isn't really great, maybe training isn't producing the outcomes you want it to produce, and maybe you're having higher turnover numbers, it's important to consider competency-based training as an option. Again, there are other training strategies when you are experiencing these, or other strategies when you are experiencing these problems. This is one of the strategies that might solve some of these problems. So when we're talking about competency-based training, when I first started ICI, it felt very hard for me to understand what it actually meant. So ICI put together this competency-based training model, which can be used in any profession. Again, just like competencies in general can be used in any profession, so can this competency-based training model. The first thing to do is to really think about the outcomes that you want for individuals being supported. So those probably align with your mission and your vision and your values. So for example, ICI's mission is to make sure that people with disabilities are included in their communities of choice. That would be an outcome, right? So you want to identify that outcome. And then after you think about those outcomes, think about the skills that the staff that work at your organization need to be able to achieve those outcomes. So what kind of skills would a staff person need to make sure that they understand how a person can contribute to their communities of choice? There's a lot that comes in there, a lot of different skills that staff would need, and more complex things like that would take more sets of skills, right? Following that, once you identify those skills, you measure those skills to identify training needs, and those really should be staff specific. When I asked the poll question about how you decide what training tactics to train, a lot of you say you do it person specific, which is great. Just like we really want to make sure that our services are person centered, our training should be person centered as well. So it's really great to identify those skills for each person at your organization, and that's the thing that you can pull the supervisors into, and supervisors can support that and help identify what skills staff that they supervise need, and the staff themselves can help identify those skills as well. Next step is to set expectations for learning, and then select that curricula and how you're going to deliver it. Actually deliver the training and measure learning throughout the training, right? Because you want to check in with people throughout the training to make sure they're understanding what you're saying. And then transfer knowledge to the job. So again, you don't just want that training to stand alone, like Claire and I were saying earlier. You really want to have that on-the-job training and that on-the-job application to transfer it to the job. And finally, you want to measure the effectiveness of the training. Did the training meet the outcomes that we wanted it to meet? Did it change the skills of the staff? Really digging into that. And I saw somewhere in here, someone asked where you get the slides. We will be sending the slides out after this, so we will make sure to send those out. So an example of this competency-based training model, the best one and easiest one is CPR training, right? So CPR training, the outcomes for individuals being supported is making sure that they're safe and that there's someone to respond if something does happen. The skills that staff need to achieve those outcomes, well, learning what CPR is, right? Having that knowledge of what CPR is, learning how to do CPR, and then learning how to do it on the job. Measuring skills to identify staff training needs is a little bit different with CPR because typically the training is done with the assumption that people have not completed CPR training before, but sometimes at the beginning of class, there is a question asking like, who has taken this before? So they at least know if people know the basics about CPR when they start training. And then selecting the training curricula and delivery format, delivering the training and measure the learning. CPR is best in person because it is such a physical skill to teach. It's best in person, so it's delivered in person. The training curricula is already set, and the people who deliver the training are measuring learning throughout, right? They're asking for understanding. They're asking for people to give examples. They're asking for feedback throughout the training. Finally, transferring knowledge to the job looks a little bit different for CPR because you can't practice on a real person, but having those dummies is a great example of how you can transfer knowledge to the job when in a situation like CPR, where you can still practice it, but you might not be able to apply it immediately to a real situation. And then finally, measuring effectiveness of the training. CPR trainings do different things to measure the effectiveness, but sometimes that can look like surveys or tests, and those really measure the effectiveness of the training there.
Megan, we had a couple questions that came in through the chat and not through the Q&A. I just wanted to make sure that we got to those because there was one about self-directed and problem solving and addressed as far as competency-based training.
Okay.
So the question is how is working alone and in self-directed problem solving addressed? Many people work as a team in a program, but are going to community-based programs, and the brick and mortar is missed, being with groups or peers. It's a really great question. And it's a really significant question because so much of our industry is moving to that, what we'll call remote supervision. Now, self-directed services and self-directing services, there's some nuances there. If you have a person that you are supporting that does self-direct services, right? So that means that they are your employer. They also have access to the ability to provide training. And particularly in Minnesota, there are opportunities for them to have access to that for free. So it should never become a barrier as far as if a person is self-directing services. But then also the other side of that is if you are providing services where people are remotely supervised, as in they are maybe in someone's community-based living situation, that there are some really great courses in their frontline in the frontline supervision and management curriculum that Direct Course has, which is part of what I'm here to talk a little bit about, that can help you understand and know how to supervise within remote supervision.
Thank you, Claire. And when it comes to self-direction, there's a actually CMS just released. We worked with CMS on a series for folks who self-direct their services on how to train the people who are supporting them. So that's available online. If people want that link, I can get that later, but that's a new resource as well.
Sure. And I see that the question was actually not what I asked, but we got a little clarification, but it's also great. Some people may have needed that other information, but also that idea of self-managing time. There are competencies out there. And for those of you that are training to, we'll say 245D specific requirements, there is a how to be a DSP, right? What does that look like? What are the skills that one requires to basically self-direct time? And look at how are you managing that day. So highly, I can certainly send some information about that. And as we get maybe into the direct course section that I'll be here to support and talk about, we can look a little bit into that as well.
Great, thanks, Claire. Were there any other questions in the chat that you noticed? I do see that Danielle put in the chat a couple of the competencies. From Claire, a couple of the competency lists that are available online. There are a couple other as well. Any other questions?
We'll get more. It's just hard to pull them really fast and talk at the same time.
Yes, thank you. Okay, moving on. So like I said, when you're developing your competency-based training model and you're trying to figure out what training curricula to choose, there's a million out there. It's really important to make sure that that training curricula is competency-based. It makes your job easier if it's already competency-based and you already know what lessons, what competencies each lesson aligns with. Like Claire said earlier, direct course is one of those. And you as Minnesota providers have free or reduced cost access to direct course. Claire, do you have any other? I think you had a pretty good spiel earlier.
Yeah. So again, part of what the state has subsidized for people in Minnesota, and since this is a Minnesota based group, it's really important to know this because many don't. Is that the state has a contract with Direct Course or now Elsevier Publishing to really be able to provide the content within the College of Direct Supports at free or reduced cost. For organizations between around like under 10 people supported, it's a free opportunity. So again, going back to that question from before, that was not really the question, looking at how people are self-directing services. Like if you know somebody, if you have a family member who is managing their own staff and doing their own hiring, they still need to train them. This is a free resource that they can sign up for their staff. And then looking at what are some of those really affordable training costs for organizations, and then how that really the whole system supports you to manage your workforce. Because what we know is as we're managing those workforces and looking at how are people trained and feeling competent in their role, that's the competency-based training, the turnover is reduced. So you're not having to search for as many people.
And by using some of this online curriculum, it reduces whoever the trainer at your organization is, it reduces their time a little bit so that it can be spent checking in with staff and making sure that the training is what they need, right? So it doesn't mean that you don't have a trainer anymore. It just means that their role changes a little bit to more of individualized training for folks. And so when we're talking about lessons being connected to competencies, this is an example on your screen right now. Again, direct course, because this is what we know at ICI because we produce the content for direct course. There is a lesson called Strategies for Supporting People with Autism. And there are a lot more competencies that are aligned with this lesson than what's on your screen right now, but you wouldn't have been able to read it. So for CDS, the competencies that the College of Direct Support aligns with are the CMS Direct Support Workforce competencies, the NADSP competencies, and then the NADD competencies. For CES, like someone said in the chat earlier, it's aligned with those ACRE competencies. So for CFSM, it's aligned with those national frontline supervisor competencies. So depending on what curriculum you're choosing, it's aligned with different competencies because it's meant for different groups of DSPs. So moving on from selecting that training, when you're talking about measuring effectiveness of training, it's really important to do that in different ways because while people learn in different ways, people also report what they learn in different ways, right? I'm a great test taker, but other people that I know are really not good test takers. So that's not a good indicator of what they learned. So some examples of ways you can measure training is through those pre-post tests. It's also through that on-the-job observation and skill demonstration. And that means going to wherever the person worked, which is more time when you have people spread out, when you have DSPs spread out in different locations, going to where the person works and observing them using those skills on the job with the people that they're supporting. Along with that is portfolio entries or self-reporting. So DSPs saying, this is an example of when I applied the skill on the job, or this is what I've learned from this training. And then finally, assessment or self-assessment. There are a lot of really good assessment tools out there, and I'm sure a lot of you have really good assessment tools at your organizations already. An example is ICI has made an assessment tool for frontline supervisors where they assess themselves themselves, and then their supervisor assesses them. And it's based on all of those national frontline supervisor competencies to see what competency areas the frontline supervisor needs to grow in. That's one self-assessment and assessment tool that you can use, but there are tons out there. The important thing is that you're measuring that effectiveness and making sure that it is resulting in those outcomes that you want to have for your staff, so that it results in the proper supports for the people being supported. And then finally, while you're measuring effectiveness of training, it's also important to check in with staff. Just like I think I had the slide for the last webinar series that we did, just like how you want to monitor workforce strategies on a regular basis. It's important to monitor people's training on a regular basis. Even somebody who's been there years, it's important to do a periodic review of their skills and what kind of skill gaps that they might have. For example, going back to CPR, you do CPR once, you're not done forever. You should take those, I think it's every 2 years, to make sure that you are up on CPR and you remember those skills and you're able to apply them in any moment. So sometimes you lose skills and need to go back and rebuild those again. So it's important to constantly review and monitor staff to make sure that they're getting the training that they need, so that they're providing the supports that are quality and that people want. And again, Claire and I have brought this up a few times, but don't forget those frontline supervisors and managers. There are a lot of problems that can happen in an organization with staff, with supervisors and managers that aren't well trained. Conflicts can arise either amongst staff or between DSPs and supervisors, and staff can feel really unsupported by supervisors. Oftentimes DSPs don't leave the job, they leave the supervisor, they leave the boss. So it's really important to make sure that you're supporting and training those supervisors so that they can do the best job, and training them to competence just like you would for those DSPs, because we know that there are competencies there as well. So I went through that pretty quickly, but as you're reflecting on what we talked about today, think about one key takeaway that you can take from today and you can bring to your organization to improve your workforce at your organization, to improve that retention, to improve that training, and to improve the outcomes and qualities of supports for people that you are supporting. And then, are there any ideas that you heard today that you didn't know about that intrigued you, or do you need additional information to look more into this? Did you find out about a new set of competencies that you didn't know about and you'd like to do more research into? There's a bunch of links in here that you can open and save in your browser. But there are a lot of different information that we applied here today that you can use in your organization and begin to build that competency-based training model to make sure that people are getting the outcomes that they need. We're going to go into questions in just a minute, but there is a third webinar of this series about credentialing. So this was really focused on just like general training and competency-based training, what's important to give staff. The next one will be more focused on a credentialing program and putting a credentialing program into place at your organization if you're interested in that. And Daniel just put that link in the chat. So if you're interested in that, that is March 23rd at 10 a.m. On that note, I'm going to stop sharing my screen and ask if anybody has any questions. Let me scroll through the chat to see if we missed any. Someone put in the chat that the College of Direct Supports is a big system to navigate. Yes, in order to use online training, there needs to be training to on how to use it, right? So that is what Claire and one of our other colleagues, Mark, does, is they support trainers and learning administrators at organizations in how to use direct course and how to support people at their organization to use direct course. How to train immigrants and refugees who may have a language barrier is also really important. The The College of Direct Support is written at I think they try to keep it between 6th and 8th grade reading level, which sometimes isn't enough. We do the best that we can, but there are also other resources as well for folks who English maybe is their second language, and so they have a language barrier. Any other questions?
For those of you that that are already utilizing direct course, or if you are curious about it, because again, I do agree that it is a rather large system. It is a system designed to support workforce. So it is a system designed to support your organization in tracking records, keeping transcripts accurate, looking at employees. There is, and Danielle is copying everything I put because I don't have access to chat to everybody. So thank you, Danielle. There is a Google site admin toolkit, which you can look at. Depending upon the size of your organization, you might get me as your administrator. You might also be assigned either Brenna at the state or someone from Elsevier. Again, depending upon, we all use the same resources, and everybody is always invited to go ahead and have a conversation with anybody about what does that look like? How can we support you? And we have regular informational sessions, as well as training and technical assistance sessions that you can sign up for. And that's part of what the state is providing to you through their partnership with or through that contract. So love to be able to help you navigate any of those questions that you have, and just maybe show you some of the entry level easy things to seamlessly utilize them in your workforce.
Thanks, Claire. And Cindy put in the chat that going off of that, the MTI contract there is going to be developing a tool to crosswalk the requirements for waiver and VRS services and the training in CDS and CES. Danielle, is there anything else you'd like to add about that? I think Cindy covered it pretty well.
Yep. Thanks, Cindy, for shouting that out. Look for that in the next few months, hopefully.
And we do have on that website that Claire shared some crosswalks or some competencies on there as well. So if you're wanting to look at that, that's on there as well.
There's another question in the Q&A. Have you looked to see how direct course compares to the STAR services training?
We have, and there are a lot of Claire, looks like you wanted to say something.
No, we know the same information. Yeah, so direct course and STAR services, they do provide some similar training. STAR service has many options for live online with an instructor, as well as live in person. Direct course does not offer that. They are similar products, and here's what I will say is that clearly I am in the direct course camp, but we work very closely with other aspects of STAR services, and their training is also very good. So knowing that, it's really important to do your due diligence and find out which one is right for you, because it might be that you really need a specific way of learning or content delivered, and they do that better than us or different than us for you. So highly recommend checking it all out. There's no reason to not. I do know that STAR Services is not provided at free or reduced cost by the state. Again, the content is solid. And like I said, it's really looking at what training is most appropriate and fit for your organization.
Yep, just like everything else, we want the training to be person-centered. So whatever is working best for you and the people in your organization, yay, great. Someone asked who you would contact for help. Claire, looks like you're going to answer that. I'll also put the email in chat.
Great. Okay. Yep. So yeah, you would contact. I'm actually going to send you or Megan, if you could put the link to the request information from the DHS website, that would be great. But also you could just email directcoursemn@umn.edu, and I will put that into the answered questions here as well. I'm not sure if everyone can see those. I think they can, because I'm not sending them privately. And then I see a question, I can also take that one, about updates. So the question says, we were told last year by someone from CDS that CDS will be updating courses this year. Is that true? Yes, and always. So CDS is not on a, and we renew all the things, is that it's actually on a rolling basis that content is updated. The development team works continually, and there is a development plan. And what we are continually doing is looking at what are the courses that may need to be updated from our content and our curriculum currently, and those are on a development schedule. So the curriculum, the content is continually reviewed to look for updates. There is also many times linked content that is added if there's a new statute or something that is updated. If you're utilizing the 245D modules that have been pre-created by Megan and myself in the direct course bucket already, those are updated for you whenever there is a change, and we will typically send out an announcement and let people know that. As far as like specific content, like page 6 of lesson 4 in this module or in this course, if there's something that you think is really glaring, there should be a function called Change Manager, or you can go ahead and email directcourseminnesota@umn.edu, and we can have a conversation and look at what might specifically need to change. We do understand that direct course is not just utilized within Minnesota. So it is a national curriculum. So it does cross many different organizational standards and state legislatures and statutes. So knowing that it is not only specific to Minnesota, but we have created those crosswalks where the content does align with Minnesota specific requirements. Hope that answered your question.
Any other questions? Okay, well, we will stay on. Danielle just put in the chat a link to an evaluation for today's webinar, so please click on that and provide feedback. There's also a section at the end, I believe, that asks what else you would like to learn. So that's really helpful to us as well. It helps us design our future webinars. So please provide as much feedback as you would like. It's anonymous. And thank you for being here. We'll stay on for a couple more minutes if you have any questions. Otherwise, we appreciate your time, and we hope that this was what you needed to continue to improve the retention and the quality of services in your organization.